warm welcome to our distinguished representative of the Italian government, of the Italian occasion, Minister Ferruccio Fazio, Professor Fazio. Is known to all of you, but I will say a few introductory words later on. Ladies and gentlemen, the Global Health Forum is an initiative which has been promoted by the Embassy in Washington since 2006. But this year's symposium is a special one for at least 3 reasons. First and foremost, we are honored to have the Italian Minister of Health, Professor Ferruccio Fazio, opening this conference today. His presence, in his capacity of Minister of the Italian Republic and also as a renowned scientist, outlines both the importance of the topic which we will address and the strength of the ties between Italy and the United States in science and namely in health cooperation. Secondly, I would like to welcome and thank the speakers and all participants to this symposium. Today's event comes right after the celebrations for Columbus Day, a sign of great intensity of relations between our governments and our people. The Forum 2010 is part of a program promoted by the Embassy. Italy 150, the 150th anniversary of the Italian unity. You can see that I'm proud of showing the pin of the Italian, the silver pin of the Italian unity. Placed under the auspices of the President of the Republic of Italy, this program aims at celebrating in the United States the anniversary of the unification. This anniversary and this celebration is also a tribute to our unique partnership as well as to our shared values, especially to our shared values. Today, one of the most relevant features of these close ties is indeed science. A large number of Italian researchers work in the laboratories of the National Institutes of Health and of the main universities in the US. Many of them have assured key contributions to medicine, and in some cases their work has been recognized by the Royal Swedish Academy with Nobel Prizes. Scientific cooperation between Italy and the United States covers indeed all realms of medicine. The benefits reaped are shared equally not only in our countries but throughout the world. This environment is conducive to the further deepening of progress in biotechnologies and pharmaceuticals. This leads me to the third point, that is our topic today, healthy aging globally. And I believe that this topic is timely because the US health reform is just being implemented, and we can in the United States. And we can therefore share our policy experiences and compare them in the context of our partly diverging demographics. The latest OECD data show that health spending accounts for 9.1% of the Italian GDP, and that between 2000 and 2008, the health spending per capita in real terms has increased by 1.9% per year, well below, therefore, the OECD average of 4.2%. In 2007, life expectancy at birth in Italy was 81 and a half years, 2 years above the OECD average, while in the US, as a comparison, average life expectancy was 77.9 months per year. In 2009, the percentage of the Italian population over 65 was 20.1%, while it was 12.9% in the US. From this demographic data, we also garner another important information. The percentage of people over 65 is growing throughout the world. Vaccines and medicine help us research advanced. Vaccines and medicine help us reach advanced age in good health. But we are learning from the wisdom of the classic, and often unwittingly, that they are following to do so. In Seneca words of advice, and let me quote in Latin, ante senectutem curavi ut bene vivere, which I take the liberty of translating, we have to do our best to age well, but I'm not translating for Minister Fazio, because I tried to have a modest exchange of Latin quotation, and I was submerged by the richness of this culture in Latin literature. And at the same time, the opportunity of this forum and this seminar addresses a challenge. Aging as a critical emerging global health issue needs to be addressed from scientific, behavioral, economic, environmental, and political perspectives. Scientists, both in Italy and the United States, are actively engaged in this endeavor. The science of aging is a field in which Italy and the United States definitely enjoy an edge, thanks to the relevance that is given in both our countries to this new global issue. The Italian government, and let me remind that personally Prime Minister Berlusconi is engaged in promoting research in this perspective, research and cooperation in this specific area. The Italian government is strongly supporting research, and I can only mention an initiative which Minister Fazio knows very well, an initiative named Quo Vadis by Don Barzè, the founder of the Ospedale San Raffaele, which is aimed at the creation of a research center in Italy dedicated to the science of longevity. My country is heavily involved in furthering the United Nations and the G8 initiatives targeted at improving public health and fighting diseases. And among these, I would like to recall the Global Fund to fight AIDS, tuberculosis and malaria, launched by Italy in Genoa in the G8 in the year 2000, which has contributed to saving over 2 million lives, and the significant steps forward that were made in G8 and L'Aquila in 2009. In fact, defeating pandemics and endemic diseases and strengthening the health systems in developing countries are crucial and closely interlinked objectives. We are committed in this direction, both on the bilateral and multilateral levels, playing a role also in innovative funding in the struggle against HIV, AIDS, and tuberculosis and malaria. The engine behind all this progress is the continuous relationship between fundamental research and development. The great strides made in genetics, nanotechnology, and chemistry are quickly incorporated in this ever-evolving science, medicine. This event owes much indeed to Rear Admiral Dr. Susan Blumenthal. Her enthusiasm, experience, and expertise have been truly invaluable and the driving force for this symposium. Thank you, Dr. Blumenthal, for making this event possible. I am deeply honored to give the floor to Professor Ferruccio Fazio, Professor of Diagnostic, Imaging, and Radiation Oncology at the University of Milano Bicocca. Minister Fazio has also been chairman of the Department of Nuclear Medicine and Radiation Oncology at the Scientific Institute San Raffaele in Milan, and director at the Institute for Molecular Imaging and Physiology of the Centro Nazionale delle Ricerche, director of the PET Cyclotron Center at the Scientific HS San Raffaele, Milan, and he has published a very impressive amount and qualitative set of scientific papers, 350 full papers on international peer-reviewed journals. Minister Fazio is a world-recognized scientist and a true leader in the Italian and European medical environment. Thank you very much, Mr. Fazio.
Thank you, Ambassador, for your words and for organizing together with Admiral Susan Blumenthal this forum, which is indeed very timely. I wonder whether some of you has read a report published a few days ago by Standard & Poor's entitled Global Aging 2010. It says that public debt of countries with advanced economics will explode in the next 40 years due to population aging. Without changes of fiscal policies, that assumes no changes, of course, in fiscal policies, public debt over GDP will raise for countries such as France, Germany, UK, and the United States over 400% in 40 years. The report considers 32 countries with advanced economics and 17 emerging countries. World population over 65 will increase worldwide in 2050 from 7.6, which is what is now, to 16.2%. The report points out there was an opportunity window until 2020, but this has been hampered by the recent crisis, which has increased deficit and public debt in most countries with advanced economies. After year 2020, population aging will further increase with devastating consequences for government finances. Thus, the report urges advanced countries to adopt measures not only to further reduce public expenditure, which is known, and to increase economic growth, but also to reform pension schemes and to reform health policies. Interestingly, Italy is in a better position relative to other countries. Debt over GDP will, according to the report, raise from 115% to 245 in 2050, whereas France and Germany from 75 to 400. This is because the progress made by our country, by Italy, in the last 20 years on pensions and retirement policies, and to a certain extent because of the pretty good health system as well. Anyway, the report points the need of adapt health system to global aging. Aging has a tremendous impact on health systems. Numbers are known: 20% in Italy over 65. Remember that 1/2 the person over 65 has a probability of having 2 or more chronic disease, which means in and out of hospital at the present state of affairs. So we have 20% in Italy, we have 20% of people over 65, which are responsible for 40% of hospital admissions, which means in 2050 we will have certainly no sustainability. Leave alone the fact that the old person don't like to go in and out from hospitals. They are better taken care of at home, in a residential situation where a relative can visit them, when it's a more like hotel situation rather than hospitals. But aside from that, simply there won't be any sustainability if we don't change the system. So what can we do? Rule of thumb, 3 things I suggest can be done, which is prevention policies, obvious, strengthening primary care, and governing appropriateness.